neuropsychology of spinal cord injury in human beings. Spinal cord injury is defined as damage to any part of the spinal cord or nerves at the end of the spinal canal. Here's a diagram showing different levels of injury in the spinal cord, cervical, thoracic, lumbar, sacral. An injury at C4, for instance, would be from the neck down, you'd be paralyzed. C6, you have a little bit of movement in your shoulders. Thoracic 6, you'd have from the chest down, and L1 or at the lower, and you'd have paraplegia, or be paralyzed from the waist down. Comorbidity is a term that I'm going to be using in this presentation. It means having two or more symptoms that go along with a diagnosis, and they can occur at the same time or one after the other. And it also implies that interactions between the illnesses can worsen the course of both. So they play off each other. It's kind of like synergy in reverse, 1 + 1 = 3. Some examples are depression and chronic pain. The more depressed you are, the more you might focus on chronic pain, and the more chronic pain you have, the more depressed you get. Here are some symptoms comorbid with spinal cord injury: sexual dysfunction, neuropathic pain, which is especially, it's a different kind of pain than many of us are used to. It actually takes place because nerves are actually damaged or become dysfunctional. And you can't treat it with ordinary pain medication. You have to use anticonvulsants. It's the best treatment that people have for this kind of pain. And also depression. Depression is caused by the intense pain and a tendency by the SCI sufferer to catastrophize the situation they're in. So basically, I mean, honestly, if I wound up with a spinal cord injury, I would consider it a little bit of a catastrophe. But what they're saying here, what I'm saying here is it's not in the best interest of the spinal cord injury sufferer to let that happen psychologically. It's better for them to just try to take it on and move forward. Okay, male and female sexual dysfunction, another component of spinal cord injury. Sexual desire originates in the amygdala. Psychogenic sexual arousal is being aroused by something visual or in your surroundings, but not actually physical. And then reflexogenic sexual arousal is actually physical stimulation of the genitals. And these are, you notice here, for psychogenic sexual arousal, thoracic 11 to L2, that's where you would lose that function, and reflexogenic is below L1. But the results can differ. Not every single person with spinal cord injury at those locations will suffer the exact same symptoms. Male sexual dysfunction. There are several treatment options to help increase the number of erections and how long they last. Options include medications, sildenafil, Viagra, implants in the penis, penile injections that have to be done right before sex, and medications applied to the penis topically and sexual aids. There's also vacuum-assisted aid, which you put a cylinder over the penis and pump all the air out of it, and it pulls blood into it from other parts of the body. Female sexual dysfunction. SCI sufferers, 50% of women couldn't produce vaginal lubrication, 66% couldn't produce orgasm, and there's actually a lot of speculation right now that the cranial nerve 10, the vagus nerve, is involved in female orgasm. It's suggested that to overcome these things, that mechanical vibration stimulation be used. Okay, chronic pain. It's been reported in approximately 94% of spinal cord injury sufferers. The pain's in multiple locations, and it definitely increases the likelihood of depression. Coping skills related to chronic pain. So you can reinterpret the pain. Something that a lot of chronic pain sufferers do is they fear the pain. It's like, so not only are they in pain, but they're scared of the pain at the same time, and they feel overwhelmed by it. So this is suggesting that you try to teach yourself to recognize it as less threatening. That way, it may still hurt, but it doesn't have that psychological power over you. Here's some coping self-statements. I can manage the situation if I take it one step at a time instead of thinking of the whole life's ordeal going through life with a spinal cord injury all at once. Meditation works to alleviate pain, and resilience I'm going to be talking about in a few slides here. It's very important in overcoming spinal cord injury. Depression. Neuropathic pain correlates significantly with depression levels. Like I said before, depression and neuropathic pain are very closely related to each other. Negative self-evaluations can keep you in a depressed state, saying, oh, I can't do this, I'm not good enough, stuff like that. Or poor coping strategies, which would be like picking up a drug habit to cope with the new lifestyle that one has with a spinal cord injury. And then there's loss of perceived locus of control. That's basically, people go through life feeling like they have a fairly good amount of control over themselves. And when they get a spinal cord injury, all that illusion of control goes out the window. And they're faced with their own mortality and the fact that they had no control over this SCI. And that can be traumatic and cause depression. Treating depression, antidepressants such as SSRIs. Resilience, again, mitigates the perception of depression, and it also contributes to increased life satisfaction in individuals with SCI. Resilience, here we go. Resilience is a process in which one has the ability to cope and adapt in the face of adversity and or to bounce back and restore positive functioning when stressors become overwhelming. So basically, it's like a mindset that comes from personal qualities such as optimism and courage. And this mindset gives you the ability to bounce back from whatever trying events a person goes through in life. There are ways to teach resilience if you don't already have it. Positive psychology, strengths-based cognitive behavioral therapy can create resilience in patients that are without it. These are the steps to resilience. Step one, you search for strengths within positive sustained activities that already exist within the patient. I use the example of a DJ or an athlete. What it is some people may have this resilience built into them, but only in a certain facet of life. So they're resilient about their athletics, or a DJ spinning music. Like if they get criticized or if they have a bad showing, it doesn't bother them and they just bounce right back and keep going. Well, it doesn't mean that they have that in every aspect of their life though. So this therapy, trying to bring out resilience, is designed to go in, find out where a person is resilient, and then pull that out and spread that around to the rest of the facets of their life so they can be resilient in every area. And then if you have other problem areas, you apply the personal model of resilience to them and hopefully overcome them. And it takes a lot of practice. Okay, post-traumatic growth. That's the goal of SCI sufferers. Individuals with SCI come to terms with their injuries. They aren't thinking of things like, oh, if I hadn't done that, oh, if I wouldn't have taken that chance, I wouldn't have a spinal cord injury. They just basically own it and move on. And they find new hope and clarity in their lives and start looking toward the future. And then the neat thing is they realize that as spinal cord injury survivors, they can have a positive impact on the lives of others, especially other people suffering with illnesses or spinal cord injury. So if you can imagine a person that has had spinal cord injury for, let's say, 15 years, and they've already gone through all the processes of getting to post-traumatic growth, and then you have a fresh, somebody that just comes in with a new injury, and they don't know anything yet. They're still catastrophizing the spinal cord injury in their minds, and they feel overwhelmed. Well, you can imagine that somebody that has already been through it can kind of mentor that person and help them reach the post-traumatic growth too. And also, in the post-traumatic growth stage, you can engage in Paralympics or planned activities with others with SCI. And this is like you see people playing basketball in wheelchairs, or competing in the Paralympics, or skiing on skis where you sit down and you have two poles with skis on them, and you sit on one bigger ski, and that offers them all a chance to get together and not be comparing themselves to people who don't have spinal cord injury. It's like very inclusive group of spinal cord injury sufferers. And to wrap it up, sexual dysfunction, neuropathic pain, and depression are all comorbid in spinal cord injury, and they all play off each other. You can be depressed because you have sexual dysfunction. You can have sexual dysfunction because you're depressed. You can have neuropathic pain interfering with your ability to have sex. You can have depression from the neuropathic pain. It's just like they're all interwoven together, and they all work together to try to make things worse. But the good news is that all of these things can be lessened in severity or totally overcome with available treatments. That's it.
All right. Questions?
Any questions?
So Alan, what was the most interesting thing you came across researching for this presentation? Something you didn't know before that you were just surprised to?
I was surprised at the length some people would go to have sex while they were having sexual dysfunction, as far as injecting medicine into the penis. Mm-hmm. Like, that was kind of extreme to me, I thought, but it's not extreme to them, because they're just looking for any way to get around the problem. Mm-hmm. And it made me realize, like, kind of made me see things from their perspective. Like, if that's not a big deal, if injecting something into the penis isn't a big deal, imagine what they're going through to make it not a big deal. Also, I was really interested in resilience and the way the cognitive behavioral therapy could actually teach people resilience. Because I think every one of us has met or known somebody who just keeps going, and they're full of light and courage and strength, and they don't let anything get them down. But that's something that we can all have. It's not that you're just born with it or you're not born with it. It can be taught.
Other questions?